Hi everybody, today my topic is significance of sub-arch deep plane straight lifting. Thank you. If you have any question, please don't hesitate to contact me. Thank you. Let's discuss about this picture. In the left side, it is before operation. In the right side is post-operation. In the post-op, we can see the parallel jowl sagging got somewhat improved but not so perfect. It is by traditional straight lifting. Maybe it is in the subcutaneous fat layer to lift up. So we can see the effect here is partially effective but not so perfect. Usually this condition maybe we return back the jowl sagging maybe in several weeks or several months. In this case, we hope to get much more better effect to stop the parallel jowl sagging. So maybe we lift the much more force. The lifting vector is only in the lateral-upward because it is the traditional lifting is this vector. So yes, we get a much better effect, but we get a reverse triangle face and much wider in the mid-face area because the lifting vector is only lateral-upward. In this picture, let's see the left side. It means right face here. It's epizygomatic lifting. The straight is in the subcutaneous layer and then maybe go deep. So maybe shot in from outside of SMAS. So you can lift the SMAS up and lateral the vector. So it's the lateral upward vector. In the picture right side, it is the left face. The zygomatic lifting here. The straight is go beneath the zygoma arch, so it is sub-zygomatic plane. And then in the sub-SMAS plane, it is the layer 4 of the SMAS, and then the straight struts out from inside of SMAS. So you can lift the SMAS inward up. So it is different vector with the epizygomatic lifting, the traditional method. It is totally different lifting vector. That is the significance of subzygomatic lifting here. Let's see again the animation. You can see epizygomatic lifting. The face is lift up lateralward and become widened. But in the subzygomatic lifting, the lift effect is much more natural. Look natural because it is not lifting lateral upward. It is lift maybe directly upward or maybe a little inward up. So we can compare these two different methods. It causes two different shape change here. Okay, let's discuss about the facelift here. Maybe decades ago, long ago, doctors do facelift maybe only by skin lift, maybe skin resection or skin dissect subcutaneously and lift and a part of skin. But then doctor find maybe it result very unnatural shape and deep fascia, deep tissue do not get lift, so become unnatural outlook. So SMAS technique developed and doctor do maybe SMAS lication or SMAS dissection and SMAS resection and lift, but both methods can lift up only lateral upward direction. The lift vector is only lateral upward. But the defect sagging, majorly it is buccal fat, cannot get well repositioned to its original anatomical position when she was young. So I think we should do the SMAS medial-upward lift. To lift SMAS medial-upward, the direction is only could be done by subzygomatic straight lift to lift up the SMAS medial-upward, and then to push the buccal fat back to its anatomical original position as she was young. Let's discuss with this picture. The yellow means skin, the orange ball means soft tissue, maybe deep fat, buccal fat. If only skin lift, we cannot influence the deep soft tissue, but only skin, so it's unnatural. If with SMAS lift maybe a little, you can lift up some deep tissue by lifting and maybe compression. But if we use subzygomatic straight lift, we can get an effect of SMAS medial-upward lift. So much better effect and much more natural. So let's see some before and after here. This immediately post-op you can see parallel jaw sagging improve well in the nature. This is 1 day after, another case. This is another case, 3 months post-op. This is another case, half year post-op. So you can see this case is a young female, but it is maybe her face originally is widening. But after the subzygomatic straight lip, buccal face, and the SMAS got medial-upward lift, so we got the result of the face maybe the smaller and much more natural. Why does sagging jaw occur? First, superficial fat deposit drooping, so it causes some contribution to the sagging jaw. Second, deep fat atrophy. Deep fat atrophy causes support system unstable, enhance worsen skin droopy. Third, skin loosening, especially in aging case. Skin loosening may be worsen parallel jaw sagging. Fourth, SMAS pulled down. Here you can see 2 circles. In the small circle area, there is only depressor. It is platysma and no any elevator or any support to prevent the deep fat sagging. And in the big circle, it includes only transverse muscle. This resources maybe a little help to prevent some sagging of deep fat. But again, there is no any elevator here. So I think this area is, we can call it as a droopy window of low face. Fifth, deep fat sagging herniate because here only had depressor and no any elevator. So maybe deep fat sagging and even herniated out of maybe to the more downward position, more superior position, because here only has depressor, only pull down force, no any lift force here.
Therefore, discuss about how to treat sagging jaws. Because subzygomatic straight lifting has the major meaning in the sagging jaw treatments, subzygomatic straight lip can let SMAS and buccal fat to go back to its anatomic original position. In the discussion I just talked about, the sagging jaws, there is many factors, including superficial fat deposit droop. So in this case, we can treat with superficial liposculpture. In case of deep fat and the SMAS droop, because no elevator here to antagonize platysma, its SMAS weak point here, low face droop window. I call it as low face droop window. In this case, we can treat it with subzygomatic lift and got a much better effect than traditional straight lift or traditional face lift. Even you do high SMAS, your traction direction, your traction vector is lateral upward. Impossible to do medial upward lift except you do subzygomatic lift. This is the direction of the zygomatic lift. Because the buccal fat is too soft to hook by the straight cork, so the target for us to lift is SMAS. The SMAS lift inward or medial upward to push back the buccal fat. In this animation, we can see the straight goes subzygomatic space, and it makes platysma to go medial upward lift and push back the buccal fat back to its original anatomical position. Let's show you how to do subzygomatic lift. Usually I do the straight in the temple area near the hairline and go into zygomatic space. So you should know here, your trocar should go out from the inside of platysma, inside of the SMAS. So you can hook SMAS and lift it to the medial upward direction. So you can see it goes through buccal fat and you should avoid into the oral space. So you can see it is under the masseter muscle and above the temporalis muscle, between the two muscle space. In my measure, I do the zygomatic straight lift and then U-turn to go in the subcutaneous layer. This U-turn we can fix the straight well by zygomatic arch. And both the superficial layer and the deep layer, we can do effective lift. Review again. It is traditional epizygomatic lifting. Maybe you do straight, maybe you do face lift. You can only get lateral upward direction lift. And this is zygomatic lifting thrust out from inside of SMAS. Thank you very much. If you have any question, please don't hesitate to contact me. Thank you. Thank you, everybody. Thank you.